a liver specialist hepatologist. Today we are going to talk on the liver day regarding some important liver issues. One of them is non-alcoholic fatty liver disease. Now we know what is non-alcoholic fatty liver disease. When somebody has fat in the liver and they are not consuming a lot of alcohol and the fat starts damaging the liver is non-alcoholic fatty liver disease. In this, you can call it as early part when there is fat in the liver, and then it becomes NASH, which is the fat starts damaging the liver. So there are two spectrums of the same disease. Now, this fat, also called as simple fatty liver disease, and when it goes to non-alcoholic steatohepatitis, is when it is becoming the second stage and a serious part of the disease. Now, a lot of people ask us, what are the symptoms of this fatty liver disease or non-alcoholic steatohepatitis, which is the severe form of this disease? Most of the times it is nothing. So, a fatigue, which is so common and it's very difficult to pick up, and lethargy, you're not able to do a lot of work, and by evening you feel tired. And there can be some pain in the right upper part of your abdomen because that's where the liver sits, and when the liver enlarges in size, the capsule gets stretched and you might get pain. So these important things that we see in non-alcoholic fatty liver disease, how common is it? Yes, it is very common. If you see, most of the ultrasounds these days show non-alcoholic fatty liver disease, or what we get as a report as fatty liver disease, but there are stages of the disease, grade 1, grade 2, grade 3, depending on the severity. Now, is it serious? In the early parts, maybe no, and that's when we have to come in and keep a check and get these patients treated and get them into a lifestyle change which actually helps them. So what is the treatment and what is the likely cause of causing non-alcoholic fatty liver disease? So of course we say non-alcoholic, the name suggests not much of alcohol. It's overweight, lot of junk food, lethargy, not working much, not having a good physical activity, which is very common these days. And of course there are some genetic issues, and a lot of drugs can do this. So very importantly, we find the cause of these things. Diabetes is so common, which causes fatty liver disease, because when there's high sugars. So first you treat the cause. If there is a medicine causing it, take it out. If it is diabetes, please control it. If it is weight, lose weight. How much weight will be the next question. It will be 8 to 10% of your body weight, which was initially there. And believe me, the fatty liver disease gets treated or cured if you may be able to lose 8 to 10% of your body weight from the initial weight. If you control your sugars very well, that actually improves and things get a lot better. Now, how can you treat it? As I just said, are there any medications? Is it serious enough? Yes, it is. So there are medications only when lifestyle changes don't work a lot, or both can be done equally together. Now, if somebody is having not able to walk or not able to do the lifestyle changes which we said, diet is so important, but they need to do this because that's the most effective treatment. The drugs cannot be taken for lifelong. The drugs are vitamin E and a lot of other drugs which actually help decrease the fat in the liver, but it's not permanent. The permanent is lifestyle changes, which is the most important thing. Now, can it cause cirrhosis, which is the final form of liver disease where there is point of no return from all these things? Yes. Nowadays, if you see, majority of people who come to us for treatment, they are non-alcoholic fatty liver disease patients who developed cirrhosis, and then they develop bleeding issues, blood vomiting, ascites, leg swellings, and some people are in confusion and lethargy, as I before said. So most importantly, get tested for non-alcoholic fatty liver disease. If you have overweight, you lose the weight, or treat the cause of this. Once you get an ultrasound report or a liver function test where the enzymes are high, you see a liver doctor, they tell you need to follow these steps and treat the cause of it. This is so important on this World Liver Day, because we need to understand that these are the things that, if taken care of at early stages, will not lead to last stages and not cause cirrhosis, and we can treat them, and life becomes so simple if we take care of these things and nip them in the bud. Thank you.